Welcome to Hello Nigeria. It is time for our top story. Now, I mentioned earlier that today is Health Tuesday. Maybe that's why I'm wearing something close to a lab coat. Pregnancy is something that is very beautiful. Now, I have never been pregnant, but people who have had babies tell you that pregnancy and childbirth helps you to realize that the coming of a baby fills a place in your heart that you never knew was empty. But with pregnancy comes certain complications, one of which is preeclampsia. And reports have it that 5 to 8% of pregnancies are often affected by this. We'll be speaking with Dr. Olaniyan Mobolaji, is a medical doctor in charge of Mimshak Nursing Homes. And he'll be talking to us about preeclampsia and pregnancy. Thank you for joining us.
Thanks for joining us, Dr. Olaniyan.
Thank you so much, Holly.
Good to have you.
Yeah, like so many people in Nigeria, including me, before this morning, I'd never heard of the word preeclampsia. What is preeclampsia?
Benga, thank you for that question. Preeclampsia is a rapidly progressing disorder which usually affects women in pregnancy and postpartum. When I say postpartum, I mean 6 weeks after pregnancy. So I'm saying it's not just restricted to pregnancy, it also dates long to 6 weeks post-pregnancy, after delivery. The good part of preeclampsia is that it's something that can be detected and taken care of properly. But because of its peculiarity, I think all health conditions, basically conditions that are referred to as hypertension, it's a very silent killer. So if you're not so careful, or if you're not attending a good or a focused antenatal care, there's a chance that it might go unnoticed until it's actually boomerang.
Okay, so is it safe to say that preeclampsia is some sort of hypertension that occurs during pregnancy or after delivery?
Yes, you are right to some extent, but there will be some elaborations to that. That's from the medical part of view.
Okay.
Preeclampsia, like I said, is a rapidly progressive disorder affecting pregnant women after 28 weeks gestational age. When I mean gestational age, I mean pregnancy. That's what I mean to say. And so that's to say that if it comes before 28 weeks in Nigeria, it's not preeclampsia. It's a condition called chronic hypertension, meaning to say that the hypertension has been existing before 28 weeks.
Okay.
28 weeks.
So what triggers it?
Before we go there, I'd like to make some clarification. I'm saying 28 weeks in Nigeria, that's the age of viability. Presumably a age where if a child comes, saying if a child comes at 28 weeks, the child can survive in Nigeria.
That's about 7 months, yeah?
Yeah, about that. A little beyond that. So that's what we can take care of in Nigeria. But you would say in some text 20 weeks. And that's to say that in US, they can take care of a baby as less as 20 weeks. The same, there are different values, 24 for UK, 20 for US, 20 for Nigeria.
Why do these values vary? Is it because of the medical facilities?
You agree with me, personnels, government policies and all that. So let's get into that, a lot of other things like that. So the causes, preeclampsia is, okay, let me actually go in depth of into what preeclampsia is. When you have a systolic blood pressure greater than 140 millimeter of mercury, or a diastolic blood pressure greater than 90 millimeters of mercury, then you say the patient has preeclampsia on 2 occasions.
As juicy and flowery as this sounds, a lot of our viewers are not medical personnel, so we want to
I was going to go. You can see that I would like to always break down every word that goes a little medical. Systolic, that's the pressure of the heart when it contracts. Diastolic, when the pressure of the heart when it relaxes. Okay. So when you have a blood pressure of 140/90, it's hypertension. But after 28 weeks gestational age in pregnancy, that's preeclampsia.
So the difference between hypertension and preeclampsia is if it happens before 28 weeks, it's hypertension.
Before.
Hypertension, then after 28 weeks, it's preeclampsia.
Yes.
So what are the symptoms of preeclampsia?
There are other values, so I'll just take them one after. I'm trying to break it down. The other one is or you have 2 pluses of protein in urine. So when your nurses take your urine sample, I'm saying a pregnant woman, you're not pregnant before, so your urine sample, and then do a deep stick test, and there's a plus, and there are 2 pluses of protein. you'll say the person has preeclampsia.
Oh, great. Yeah. So the symptoms of preeclampsia, are there any physical manifestations, or is it something that you can only find out when you do a urine or a blood test?
You can only make a diagnosis on the basis of those parameters.
Okay.
I'm saying, as a medical practitioner, I can make a diagnosis on the basis of 2 pluses of protein or systolic or diastolic blood pressure of 140/90 millimeters of mercury. But there are signs and symptoms. Even though you would want to agree with me that I said before that no symptoms, there could be no symptoms at some cases. However, the symptoms you can notice that can trigger a suspicion of preeclampsia, there could be signs of nausea and vomiting. Okay. There could be headache, be it mild, moderate, or severe. It could point towards preeclampsia.
All right.
However, the shortcoming of this is that nausea and vomiting, headache could just be general symptoms of early pregnancy. So this mask...
So it's hard to tell,
yes,
to
it's actually hard.
Where this problem is.
Speaking of the urine that you talked about earlier, I also know that when one has a kidney disease or some sort of kidney infection, they also detect a reasonable amount of protein in the urine. So at what point do you now distinguish to say, okay, this is not kidney-related issue, this is preeclampsia?
Yeah. You made some research about that. I'm really glad about that. You know, if we were to talk about hypertensive disorders in pregnancy, preeclampsia happens to be one of the 4. One of the 4. Preeclampsia, just as I've just defined, the other one is gestational hypertension, when you just have a high blood pressure without an increase in protein in the urine. That's gestational hypertension. You have chronic hypertension with superimposed preeclampsia, meaning to say that the patient had hypertension before the pregnancy, but symptoms or parameters worsened during that pregnancy.
Is it automatic for it to happen if you were hypertensive pre-pregnancy?
It's not. If it's well managed, there are a lot of cases with experience.
But are you supposed to take medications?
You are supposed to
even
take
during pregnancy?
During
there are no
pregnancies.
complications?
Yes, but these are going to be medications that are safe in pregnancy. And that is why...
Specific type?
Specific types. Now, that is why if I have an hypertensive patient in reproductive age group, one of the counseling I should do is that when you get pregnant, please come for review of your medications so that I don't give you medications that would toy with the safety of that fetus.
And in addition to that, I think it's also very important, like you mentioned, when you go to see a doctor, be very open with your doctor, let your doctor know whatever. I remember once going to the hospital, and the doctor was going to, because I was having pains, and the doctor was going to give me ibuprofen, and I said, no, I have ulcer. I said, oh, I'm sorry. So it's important that the doctor knows your medical history, so they know doctors that medication that you may or may not react to. Now, let's talk.
It's good to be medically enlightened, aware to a certain extent,
very
like
true.
you. Aware, not in the sense that you self-medicate and you turn yourself to a quack doctor or a pharmacist. Yeah, but just to understand what's going on.
Very true. So now let's talk about what happens now that a pregnant woman has preeclampsia. Is that the end of the world? Does it mean that she would lose her baby? Or does it mean that she would have to deliver her baby before time? What are the implications?
It's not the end of the world. You know, medicine, the way it's designed, is meant to be a solution. Whether preventive, whether early diagnosis, whether treatment.
Or management.
Or management, as the case may be, when complications are set in. It's supposed to be a solution. When investigations are done and your medical practitioner figures you have the condition called preeclampsia, you know, the health practitioner is supposed to intervene. How do you intervene? I didn't mention before there are risk factors for preeclampsia. A patient who has had a previous history of preeclampsia is at risk of another one in subsequent pregnancies. A patient who has a family history of preeclampsia is at risk. A patient who is less than 18 or who is greater than 40 is at risk of preeclampsia. An obese patient. Obesity, depending on the classification, the higher the rate of obesity, the higher the morbidity, and that's the way it goes. You know, so once I detect this, you know, when you go for your antenatal visit, I think the basis of this discussion is to encourage a focused antenatal visit.
Okay.
You know, when you do in some part of the world, if I'm about to get pregnant, I don't just go home and I get pregnant. You know, I tell my colleagues, John, I'm having a baby. You know, I go back to my husband, oh, fine, I think we need to make a baby now. That's planned pregnancy. You need to plan it.
It doesn't just happen like that.
It doesn't just happen like it happened.
Wow.
Yeah, it doesn't just happen. You know, and then when the pregnancy comes and you confirm it, I need to see a doctor. You go, you confirm the pregnancy. There are examinations you need to do.
I wish it was this easy. You know, the way you're saying that step by step.
No, it should be.
People just have babies. You know, they pop babies
It's all
out like
about planning.
popcorn.
I mean, that's the way I plan to do mine too. You know, you plan it.
Wow, you just plan it just like that.
You're planning to have dinner.
You know,
planning to make babies tonight.
Pop the baby like you're popping corn. Okay, now still talking about preeclampsia, yes.
Why I actually had to brief on that was because you could actually prevent it. If I see that you have risk factors, some studies say that you should give low-dose aspirin. You know, when you give low-dose aspirin after 12 weeks gestational age, it may reduce the chances of developing preeclampsia in the late pregnancy. So when I see those risk factors, I can actually do that.
Are there character traits or are there behavioral habits that can make one predisposed to having preeclampsia?
Yes, there are some social factors.
And habits, yeah.
Yes. People will smoke and people will drink excessive alcohol. You know, naturally, these are things that, you know, I'm not saying we'll just drink. I'm saying we'll drink excessively. You know, these are things that can even predispose you normally to a kidney problem.
You should even drink when you're pregnant.
I'm saying even before pregnant.
Oh, wow.
Oh, okay.
So with, you know, someone who has been on a significant alcohol drinker, there's a definition to that. You know, if we decide to go into that, it's a big topic and so on. There's a significant alcohol drinker and a significant smoker as well. So those who have had such history in the past are at risk of such. The same thing goes on. Those who have previous history of kidney problems are at risk of preeclampsia. And all that. And so that, I think that answers your question about protein in urine with those with kidney problem and the difference in preeclampsia. You understand? So if someone who has kidney problem has hypertension before the pregnancy, now has an elevated blood pressure or protein in urine in pregnancy, then you can classify that under chronic hypertension with superimposed preeclampsia.
So before we wrap things up, how important is midwifery and post and prenatal care in avoiding preeclampsia?
Preeclampsia. I'm a medical doctor, but you agree with me that the health profession, if you have to deliver a quality health care, it has to be a teamwork. You know?
Also, the midwife too has
has a very key work as well. You know? So when we are looking at that, I'm saying as a midwife, I may not be able to explain all the challenges that they face. But because we are a team, I understand what they go through during these cases. Because the management of preeclampsia, if it actually sets in, the doctor will put the medications down. These are antihypertensives and things that can prevent possible because it won't be heard of if you present with preeclampsia and you're developing complications in my presence. One of the complications, which is one of the fatal complications, is what we call eclampsia. From preeclampsia, it can progress to eclampsia.
Yes.
When someone with preeclampsia further develop a seizure, then you say the patient has an eclampsia.
But in all of this, there's hope for the baby.
There's hope.
If everything is properly handled,
So once you pick it up, you start up your antihypertensive. There are actually specific ones to use. And then there are other things we do to prevent the onset of an eclampsia.
All right.
So once you do that, the patient is fine.
Thank you so much for this very robust conversation. We've been discussing with Dr. Olaniyan Mobolaji, who is the doctor in charge of MIMSHAC Nursing Homes. MIMSHAC Nursing Homes is a nursing home dedicated to caring for elderly people. They have trained professionals to look after elderly people and pregnant women, as well as newborns, I guess.
Yeah.
Right. Do you have a social media handle? Is there any way people can contact you?
Facebook. On Facebook, I'm Olaniyan Mobolaji.
Okay.
All right.
Yeah. I think
So you
that's
can
right.
contact him if you have some other questions that you feel you need to ask him in private. We'll be going on a quick break. When we return, it'll be time to find out who is celebrating today. Stick around. Hello Nigeria continues shortly.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love am.